Hi and welcome to my presentation. My name is Mark Gabriel B. Galero with student number S333793, and today I will be discussing to you about dengue fever in the Philippines. My first slide will talk about my chosen country, which is the Philippines. This is where I was born and raised, and I grew up. And now dengue fever is one of the most well-known and feared disease in our country. Then I will be discussing about the definition of dengue fever to be followed by its two contributing factors. Then my conclusion and references. The Philippines is located in Southeast Asia, situated in the Western Pacific Ocean, and consists of more than 7,000 islands that are broadly categorized into three major divisions such as Luzon, Visayas, and Mindanao. The population rate as of May 2020 is nearly 110 million. As per government website in the Philippines, which is called PAG-ASA, their climate is tropical and is characterized by relatively high temperature, high humidity, and abundant rainfall. As you can see from the first chart, the dengue cases in 2021 is nearly 14,000 and dropped down to 5,000 in cases into 2022. Mortality rate in dengue in year 2021 is around 55 cases and went down to 40 cases in 2022. What is dengue? Dengue is a viral infection transmitted by a female mosquito called Aedes aegypti. This mosquito can survive all year round. Dengue fever is common in tropical countries like the Philippines. The second picture shows the symptoms of dengue, which are fever with any of other symptoms like pain behind the eyes, muscle and bone pain, joint pain, headache, rash, nausea, and vomiting. If this is left untreated, dengue can progress to life-threatening conditions called severe dengue. The epidemic of severe dengue was initially found in the Philippines during the 1950s and has been the main cause of hospital admission and fatality since then. The first contributing factor of dengue consists of social factors. So firstly is population growth and housing overcrowding. So it is believed that population growth in low socioeconomic families can increase the possibility of getting sick from the dengue. This is because the number of people per household are higher than usual. And with this, it can greatly influence the transmission of dengue within their household and the surroundings. So, secondly is lack of public awareness and health education. The spread of dengue fever can be the cause of lack of public's level of understanding about the importance of dengue transmission. So, public awareness and health education of dengue plays a vital role to improve and control the dengue transmission within the community. And therefore, all people should be educated about it to decrease the rate of dengue fever within the community. Lastly is rapid urbanization. So urbanization refers to the increased movement and settling of people in urban surroundings. And when a large number of people move into a new area, their basic necessities like water supply would not be sufficient enough to cover for everyone. So because of this, it can force them to store water in drums or any containers for later use. So this water from the containers can be breeding site for the mosquitoes. Also, discarded tires, bottles, pots, and pans with rainwater can also be a breeding site for the mosquitoes. So therefore, it is best to place a tight lid on any container used for water storage and throw away or empty any containers that may accumulate rainwater. Contributing factor number two. The environmental contributing factors for dengue are stagnant water, humidity, and rainfall. Stagnant water from water pots or any containers or old tires can be the place where Aedes aegypti or the mosquitoes can lay their eggs. As per Adhan et al. 2014, even a small quantity of stagnant water and as little as 40 mils can be the perfect breeding site for mosquitoes. Also, places like public playgrounds, cemetery, vegetation, lakes, and rivers are also common breeding sites for dengue. And therefore, as per the same authors, people who live near the same areas mentioned are more likely to get bitten by infected mosquitoes and get dengue. So secondly, humidity and rainfall contributes to dengue as well. Because weather temperature and humidity can influence the breeding, survival, and replication of the mosquitoes. This particular weather provides the appropriate condition for the mosquitoes to survive and transmit the dengue to the people. So if you guys still remember from my third slide, where I mentioned the climate of the Philippines, Philippines is a tropical and is characterized by relatively high temperature, high humidity, and abundant rainfall. So thus, it explains why dengue fever is common in this country. It was also reported that the peak number of dengue cases in the Philippines are between 1 to 2 months after rainy season. To summarize, dengue fever is a global health issue, especially in the Philippines, because of social factors and environmental factors. Therefore, it is vital to address each contributing factor in order to reduce and manage effectively the number of dengue cases, especially in the Philippines. So the next two slides are the references for my presentation. So this ends my presentation and thanks so much for listening.